We've got breaking news from China, where the coronavirus outbreak took a very frightening turn overnight. Chinese health officials have adopted a new testing method, and the results are dramatic. The illness killed 254 people in just one day. That more than doubles a previous daily record. The total number of people infected worldwide is now more than 60,000.
An American evacuated from the epicenter of the outbreak, who arrived in San Diego last week, has become the 14th coronavirus case in the U.S. And we're told more people aboard a cruise ship have tested positive for the virus. Debora Patta is in Hong Kong. Deborah, how are they doing?
Good morning. Well, more than 200 people on that cruise ship are now infected. We're also learning that elderly passengers with medical conditions will be allowed to disembark tomorrow, provided they pass final health checks, but they will still be placed into a government quarantine facility before being released next week. Some passengers on board, however, are battling with isolation.
We're now into the second week. It seems an eternity.
Cabin fever has set in on the Diamond Princess. The ship has been on lockdown in Yokohama for more than a week, becoming a virtual incubator for the disease.
It's starting to get to a point where you can definitely feel things getting tougher.
Fear is also proving to be as contagious as the virus.
We have 2 cruise ships that have experienced delayed port clearance.
The MS Westerdam was barred from 4 ports across Asia over concerns about the virus, despite the fact that no cases have been confirmed on board. Today, it found a home.
Cambodia agreed to accept the Westerdam cruise ship, which has been stranded at sea for several days.
Adding to those fears, China reported a record number of single-day deaths and new cases on Wednesday. Pathologist Professor John Nichols was a prominent researcher during the 2003 SARS outbreak. Does that mean this outbreak is worse than we think, or are we just not understanding it properly?
I think the second scenario is more likely, is that we're actually now getting a better indication of what's really happening in the community.
Authorities in China are now confirming infections based on CT scans of patients' lungs. Health officials previously depended on lab tests, which can take days to process, creating a backlog of untested cases. There's just so much we still don't know.
But right now you have so much pressure from everybody saying, you know, we want instant results, we want something right now. Everybody's just trying to keep one step ahead of this fast evolving situation.
Here in Hong Kong, they're still battling with the virus and how to deal with it, but they're taking no chances. The Catholic Church today took the unusual step of suspending public mass for at least 2 weeks. Tony?
A lot of people worried. Deborah, thank you very much.